I'm in Nairobi, Kenya's capital, where the country's public health system has been pushed to the brink for the past 43 days. The impact is being felt across the country, from major cities to smaller towns. Here's why. Clinical officers and nurses are on strike, leaving many public hospitals unable to provide essential services. For patients, the consequences have been severe. Many are traveling long distances to seek treatment at private facilities, while others are staying home with few options and hoping their conditions do not worsen.
I believe the health ministry can do better because like today, I normally come for a neuro clinic and today it's overwhelming. It's urgent, it's something that has to be attended to, and now the doctors cannot take all the patients in. And now, when you're being referred to a private hospital, it's even more expensive.
The rate at which people are dying is unbelievable. So unless the government comes in, they have a conversation with the relevant authorities in health sector, then things will get out of hand. Very soon we'll get the information that the morgues are full.
So what led to this strike? At the center of the dispute is a collective bargaining agreement that was negotiated with the government but has yet to be formally implemented. For the agreement to take effect, it must be signed and deposited with the Salaries and Remuneration Commission. Health workers also say promotions have stalled, risk allowances remain unpaid, and thousands of workers hired under the Universal Health Coverage Program are still employed on temporary contracts.
The patients are really suffering, and it's something that really distresses us as the workers. But then we cannot also sit in facilities where we are not even being provided with the right equipment, and then we supervise more suffering instead of alleviating it. And that is why sometimes we have to come out to ensure we have workers who are motivated to see them, but also to ensure that we have the requisite equipment and the diagnostic capacity that must also be able to assist us to give them a quality diagnosis.
The union says both the national government and county governors have shown little urgency in addressing these concerns. Until a solution is found, it is patients who will continue to bear the brunt of the industrial action.